Oh, hi everyone. I'm the director for Common Knowledge Trust. We're a New Zealand registered not-for-profit. I'm also a naturopath with 50 years of experience working in third world countries as well as in developed countries. And I'm an individual who had COVID in March of 2020, and I've experienced post-COVID symptoms. And our trust created a protocol to use as soon as you get sick. And I developed it because as soon as I got sick, I'm a fiddler. And I believe that you need to take care of yourself. And what I was hearing in January and February of 2020 from all governments and all health systems around the world was a simple message. If you feel sick, go home, isolate, don't overwhelm your health system, go to the hospital if you're having trouble breathing. And for me, as an old woman who has a genetic metabolic disorder, that just scared the bejesus out of me, and I knew it would scare other people as well. It's basically go home, do nothing, and hope you don't die. And that was not going to be okay in my life. So I developed the trust for the protocol, and it's been posted in a number of long haul Facebook groups. Please search for it. I've been asked not to continue to attach that, which is fine. And take care of yourself. Some people have asked, should you continue to use those skills when you're long haul? Yes, because you're continuing to help your body get rid and metabolize out this virus or the metabolic waste products of this virus. And that helps your body recover. It's always remember, deep cut. What do you do with a deep cut? You keep it clean. You don't eliminate it. You don't cure it. You help your body. And this is what we need to do with the COVID at this point. So I was asked to do something about constipation, and I was very constipated early in my life, and I tried a lot of different things, and then I settled on basically one thing with a few little adjunctive things around it, and now, my ripe old age, I have fine bowel movements. So let me talk about constipation as I know it, not medically. Go do your research about medicine. And because our trust is called common knowledge, we advocate that you use any and all healthcare systems that you particularly want to use. Every little bit helps. That's the concept that we're working on. Every little bit helps. So if you can help yourself with diet, that's fine. I personally, because I worked in pregnancy and childbirth, and our trust has a website, birthingbetter.org, in which we have online birth classes. When those families and I were developing the skills in the early 1970s, I learned very early, working with very diverse people, do not talk religion, don't talk politics, and don't talk diet. So I'm not the person to go to about diet and constipation. I still stay away from it. And partly because I have discovered in the past few years I have a genetic metabolic disorder, which means that it's very challenging for me metabolically, because I don't metabolize B vitamins, to choose a particular diet. So that's not me. You're not going to get that from me. Okay, constipation. What I learned about COVID right away, as soon as I got it, was you have to hydrate. Absolutely have to hydrate. Now remember, I have no medical training, so I'm going to say this to you in the layman's terms that I explained it to myself. Okay, our body is dealing with something that is very, very new. So its metabolism, its immune system revs up. That expends energy. It also expends the fluid in our body. Because the fluid in our body, we have different kinds of fluids, as you know. We have tears, we pee, we have mucus, right? So we have different types of fluids. And what I found as soon as I got sick was my lips got dry. And I know from the work that I do that if you go like that and your lips are dry at all, or if you pinch your skin and it stays up in any way, it doesn't just flatten down, you're dehydrated. It is vitally important, even if you're a long hauler, that you hydrate very well. Now let me tell you what doesn't hydrate you. Tea, coffee, sodas. Okay, forget that. Not even water. What hydrates you is oral rehydration, which you can make for yourself. You just sprinkle a little bit of salt, and if you can get non-iodized salt, yippee, and if you can't, doesn't matter. Little bit of sweet, no artificial sweeteners, please. It doesn't matter what kind of sweet. How sweet and salty should this be? Everybody has different tastes, and for those of us who lost our sense of taste, we sometimes can't distinguish between flavors, but most of us can still taste salty and sweet. So you want this to be very palatable because you're going to make 3 to 5 liters or quarts of it warm. You can do it 1 quart at a time. So let me explain to you about fluids. As I said, it's all layman's terms. Okay, if we drink water, it just goes through us. We pee. So people who are constipated will say, I drink lots, I pee lots, doesn't change my bowels. It doesn't, because it's not going into our cells and it's not going into our intestines. And so you need to have this oral rehydration. It's also picking up trivia by the leaps and bounds in my life. I was listening to somebody who was talking about survival in the desert, and he was saying if you have 2 quarts of water, most people will think sip it, but our body doesn't metabolize sipped water very well. So it is better to drink a large volume of it. And what does that mean? Because a lot of people think, oh my God, well, your body actually will give you the information. So when you drink, you just drink, glub, 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 glub. And at some point, your tummy just says to you, enough, stop. Then do it again in a few hours. So you need to, if you are a long hauler, be hydrating. And I can tell from the comments in these long haul Facebook groups, you're not, right? Because I'm a nitpicker and I can tell what people are saying. Right? And a lot of the symptoms are exacerbated, made worse by the fact that you're not hydrated. 3 to 5 quarts or liters per day, warm, not cold, because you're then asking your body to warm up the fluid that you need to utilize. You're helping your body. You need to help your body. You need to help your body. Your mind needs to help your body. You need to choose how to do this, right? So the first thing about constipation or diarrhea, and we will talk about diarrhea next time, you must hydrate. I cannot tell you how important it is for people who have long haul. You must hydrate. You must hydrate. I can't say it enough. Okay, so there you go. Got me. This is like an old lady going, da, 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 da. You're right. Okay, so hydrate. Okay. Now, because I said before, I'm not going to talk about diet because that's what I learned in the early 70s working with pregnant families. No diet, no religion, no politics. Okay, too hard for people to change. You do it on your own. Okay. It's important when you're constipated that the fluids in your body get into your intestines and bulk up the fiber in your intestines. Most of us are not consuming sufficient fiber. I didn't really actually know what that meant. I was a vegetarian for 27 years and ended up with blocked arteries because I have a genetic metabolic disorder. I was eating fiber and I was very constipated. I was drinking lots of fluids, but not oral rehydration. So those sort of have to go together. But they have to go together in a sort of a kind of way, and they have to go together very slowly. So what I have found that works, excuse me, and works for everyone is ground flaxseed. Now, what's the difference between psyllium and flaxseed? Psyllium is sticky. Flaxseed attracts water, okay, or rehydration, flaxseed, ground flaxseed. However, if you are very constipated, just whipping in a teaspoon of ground flaxseed is going to make you more constipated and make you very uncomfortable. So everything I've done in 50 years of being a naturopath, particularly working with people with severe disabilities and with pregnancies, is you must start slowly. I am not working one-on-one with you, so you have to listen to what I'm saying, and then you have to modify for yourself. If you are very constipated, you need to take a pinch of flaxseed. And I don't mean a big pinch, I mean a tiny pinch. And you need to just put that in each liter of oral rehydration. You're going to look at it and you're going to go, nothing in there. Fine, nothing in there, okay? Because you're going to do this slowly. You are teaching your body to bulk up the fiber, and for that bulked fiber, wet bulked fiber, that it's in your intestines, okay? So you do that slowly, and you do not change from a pinch, little pinch, for at least a week. And if doing that makes you uncomfortable, you only do one pinch a day. And I'm serious about this. If you want your body to begin to poop and to poop well, you must train the fluid to get into your intestines and bulk up the fiber. Let me tell you, early on I said body has fluids. Okay, tears are one, urine is one, mucus. Most of us think mucus is a bad thing. So this is going to sort of be off track here. Okay, everything in our body besides bones and teeth is a form of connective tissue, not hair. Okay, muscles are a form of connective tissue, ligaments, tendons, all that stuff. What holds our skin to our muscles, what's hold our muscles to our bones, all the fibers in our muscles, what's inside of all of us, this is all connective tissue. When we have pain in our body, yes, our spine can be out, or that we can have problems, but just general pain in our body, it is because that area of the connective tissue is dried out, because connective tissue is moistened by internal mucus. And this is where using your mind and yoking it to your body is important. Okay? Same way with constipation. It is mucus inside, not bad mucus. It's sort of like oily. It's like, moving like that. So you get the fluid in your intestines, you get the fiber in your intestines, and when you have good poops, you feel it come down through your intestines. You feel it slide. That's the positive mucus in your bowel. And then it opens up your sphincter and you come out. And when you have a good bowel movement, it has actually a ridge on it. And it actually is well formed. And they can be this long or longer, right? It's mucus. And you want to encourage that mucus. So one is these tiny little pinches of ground flaxseed into your warm oral rehydration. And do that for a week. It does not matter if you poop at the end of the week. You are just training and teaching your body. Okay, so that's a do. The other do thing is use your mind. Okay, say to your body, I'm doing this for us. Okay, I am going to put oral rehydration, a little bit of fiber, into this fluid, and we're going to drink until my tummy says I'm finished. Then I'm going to do that again in a few hours, and I'm going to keep doing this and keep doing this. And what I want you to do, body, is to take that fiber, that moistened fiber, and keep it in my intestines, because I want it to come out my other end. Okay. Now people say to me, why do you talk to your body? Because it's ours. I mean, honestly, we talk to our body all the time. I can hear something over here, and I say to my body, turn my head. Do people know they're saying it? Oftentimes we do. Someone will say, look up there. So we take our body and look up there. So we talk to our body all the time, and we need to talk to our body. We need to own it. And are there any side benefits of COVID? Oh, it's made a lot of us more body aware for sure. And that's good, right? That's good. Because having self-help tools is good. Okay, that's good. Okay, so do I suggest laxatives? That's up to you. Use any and all types of healthcare you want. Okay, if you want to not be using laxatives, then you need to get the fiber in your intestines to bulk up, and you need to get that mucus moving in the lining of the intestines. Okay. The two supplements that really work well with this are vitamin C's and magnesiums. Even Epsom salts is a magnesium, but don't get it fragranced because you're not going to drink it with fragrance. But even if you have a bathtub, putting Epsom salts in baths is very, very calming. But both Epsoms, both magnesium and vitamin C at a high level of ingestion causes you to poop. Okay, and it happens that magnesium and vitamin C are two of the supplements that we can use in our long haul COVID recovery. Why? Because magnesium deals with a lot of the cramping, and the vitamin C, and this is, I'm going to get into one of these other videos, is very important to protecting the lining of our cardiovascular system. 100,000 miles of this thing, right? And inside all of our veins and arteries is this very thin lining of cells called an endothelial cell. And it's also the lining of our intestines, right? So vitamin C protects the protects the endothelial cells in our cardiovascular system. And magnesium relaxes our cardiovascular system. So how do you take vitamin C and magnesium as if you choose to, along with what you're doing? First of all, please don't right away, okay? Just work with the fiber. If you get to a week and you're fine, you may not have pooped, make your pinch a little bit bigger, right? And just keep making it a little bit bigger. Then, when you feel like it, if you feel like it, take that pinch and sprinkle it on food. Any food will do. Ground flaxseed has no flavor. It's a thickening agent. You can use it to thicken soups and gravies. It's a thickening agent, but it's a fiber agent, right? Unlike other thickening agents like flour or cornstarch. So when you get in the habit of using ground flaxseed, how much fiber should we use? 6 tablespoons a day, right? And does that mean I use 6 tablespoons of ground flaxseed? I sprinkle it on everything. And I go through periods still where I'm constipated a little bit, and I start off with it in water. That's easier for my body to utilize. Okay, so don't start with the magnesium for trying to get your bowels movement, but do start with the magnesium and vitamin C as a way to protect the endothelial cells and heal the endothelial cells and also relax the cardiovascular system. How much vitamin C and magnesium should you use? Hard to say. Lots of different forms of this. The vitamin C is always best when you get it with some bioflavonoids. And magnesium can be taken as as I said, you can just get Epsom salts and dilute it. Take a little bit. Always start with a little bit, because our tendency is to think of medications as take this every 4 to 6 hours, and it's a set dosage. When we're taking care of ourselves, we have to start with a small something, okay? Because we are asking our body to accept this and to utilize it. And we don't want to overwhelm it. So you start slow. There is powdered vitamin C. You can get it in different flavors. There's powdered magnesium. You can mix them together and take them in warm water. I'm a believer in warm water, room temperature water. Okay. So the other thing is to massage your belly. So your large intestines ends up down there, and it sort of has a thing here, and then it goes up one side, goes across, goes there, and then it attaches, and it goes through all the small intestines, and eventually gets up to the stomach. The stomach gets up to our mouth. So if you reverse it, okay, it goes from your mouth down to your stomach, down to your small intestines, yada, da, 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 comes in here, over on your right side, where your appendix is, and goes up, goes this way, this way. It is not uncommon for people to have a slight prolapse of their large intestines. So what you do, and I'm not going to stand up and show you, you start at your pubic bone here, and you just gently lift and out to the side. Gently lift and out to the side. gently lift and out to the side. And repeat. You can repeat it several times a day. You can do it once. You can do it every other day. Once a week. It doesn't matter. It's a skill. I've passed this skill on to you now. The other is the yoga, is that you start above your pubic bone, you draw your belly in, and then try to roll it up through your belly. Start there, roll it up. Start there, roll it up. Start there, roll it up. And you can do these things lying down, sitting, standing, walking, anything you want. And then you can go side to side. So because your bowel starts in your lower right, goes up, goes across underneath your liver on your right side, goes across below your diaphragm, and goes down your left side, and then ends up in that S shape, and then meets your rectum, then you want to contract your belly on the right side and push over to the left side. Contract on the right side and push to the left side. Contract to the right side and push to the left side. And you can combine those two. So you can start on the lower right side and go up and then across and then down. Right? So you're going up and across and down. This is our mind talking to our body and helping our body. One last thing before I finish this one about constipation. If you feel you need to have a bowel movement, don't stop and wait. Okay. When your body says to you, yep, then try to find a toilet and go then. Okay. So if you have any questions, post them. That's great. And I'm just going to go day by day through all these 20 symptoms until I run out of things to say. And thank you for letting me post onto your Facebook groups. I appreciate it. Bye-bye, and thanks for listening.